So picture this. You live in a city that's famous for having the best medical care in the entire world. But when you actually need a doctor, you're told the wait is 2 years. I'm not making that up. For millions of people, that is the reality. But there's a new technology that's starting to completely change that equation, and it's promising almost instant access to care. All right, let's get into how AI is basically becoming the new front door to your doctor's office. That voice you just heard, that's Tammy McDonald. She lives in Westwood, Massachusetts. And when her primary care doctor passed away suddenly, she was, well, in a pretty desperate spot. She needed refills for her blood pressure medication, a follow-up after a breast cancer scare, but every single clinic she called gave her the exact same answer. Sorry, we're not taking new patients. I mean, the contrast she was facing was just staggering. Some offices told her, yeah, maybe in a year and a half, maybe 2 years, we can see you. That's an impossible wait when you're dealing with your health. But then she found another way, an option powered by AI. And just like that, a 2-year waitlist turned into an appointment for the very next day. So how on earth is that even possible? Well, this huge shift is happening because technology is finally stepping in to fill this massive, massive gap in our healthcare system. It's essentially putting a doctor, or at least the front door to one, right there in your pocket. And this isn't just a few people having a hard time. We're talking about a problem on a national scale. About 17% of all adults in the US don't have a primary care doctor. To fight this, huge hospital networks like Mass General Brigham are launching these new AI-supported programs. The one that Tammy McDonald used, it's called Care Connect, and it was created as a direct answer to this crisis. Okay, so we get why these systems are being built, but how do they actually work? What's going on behind the scenes? What's the tech that makes a next-day appointment a reality? The whole thing really boils down to a concept called remote patient monitoring, or RPM for short. At its heart, it's all about using tech to bring healthcare out of the hospital and into your daily life. These AI-powered RPM systems are always on, tracking your health metrics wherever you are, at home, at work, you name it. And this lets doctors provide proactive care instead of just reacting when things go wrong. So let's kind of follow the data step by step. It all starts with sensors and wearables, your smartwatch, maybe a special monitor, collecting your health data. Then that info gets beamed securely over a network and stored in the cloud. And this is where the magic happens. The AI engine, the real brain of this whole operation, crunches all that data, looking for patterns, for anomalies, for anything important. And finally, it serves up those insights on a simple screen for both you and your doctor to see. And we're not talking about some crazy futuristic gadgets here. A lot of us are already using these things every single day. It's your smartwatch tracking your heart rate while you sleep. It's a continuous glucose monitor helping someone manage their diabetes. Or it's a wearable ECG that can detect an irregular heartbeat. These everyday devices, they're the new front line of data collection. Okay, so that's the basic setup. But what does it look like when you actually put this stuff to the test? Helping real people with real health problems. Let's check out a couple of really powerful examples. 51%. Just let that number sink in. This came from the first ever clinical trial of a generative AI chatbot for therapy. It's called Therabot. In the study, people who had been diagnosed with depression saw their symptoms drop by an average of 51%. I mean, that's a result that's right on par with what you'd expect from traditional in-person therapy. Incredible. But, maybe the most amazing part wasn't just the clinical results. It was the human connection. Nicholas Jacobson, the lead researcher from Dartmouth, he said they were shocked to see users starting to treat the AI like a friend, forming real relationships with it. It turns out people felt they could really open up to a bot because they knew it would never, ever judge them. And this goes way beyond just mental health. AI is being used to manage chronic diseases, predicting problems before they become emergencies. It's watching over patients after they leave the hospital, and one study showed it cut readmissions by 30%. And it's helping our elderly family members live safer, more independent lives by automatically detecting falls and calling for help. Okay, so this technology is obviously incredibly promising, but it also brings up a giant question. With all this super personal health data flying around, being collected, sent, analyzed, who's making sure it's all safe? What are the rules here? So in the United States, the main rulebook is HIPAA. It's the big federal law that sets the standard for protecting your sensitive health information. Basically, its entire job is to make sure your data isn't being shared or used unless you know about it and say it's okay. But here's the thing. HIPAA was written way before anyone was thinking about AI, and that creates some new hurdles. Healthcare providers using these tools have to be absolutely obsessed with three things. First, locking down those huge amounts of data. Second, making their AI vendors sign something called a Business Associate Agreement, or a BAA. This is a super important legal contract that forces the tech company to follow the exact same strict privacy rules as the hospital. And third, they have to be totally transparent with patients about how their data is being used, because without trust, this whole thing falls apart. And you can bet the regulators, like the FDA, are racing to keep up. Just look at this timeline. It shows how fast things are moving, from just talking about it in 2019 to putting out specific action plans and guidance today. They are literally building the regulatory airplane while it is already in the air. So when you pull all these different threads together, the amazing technology, the real-world uses, the rules that are being written as we speak, what does the future of medicine actually start to look like? Now, the vision here isn't about replacing doctors. It's about giving them superpowers. The future is a world where AI co-pilots are as common in an exam room as a stethoscope. These tools will listen to the conversation, draft notes, and instantly pull together all of a patient's data with the latest medical research, all so the doctor can focus 100% on the human being sitting right in front of them. And the transformations this could bring, wow, they're just breathtaking. We're talking about moving away from just treating people when they're sick to actually predicting health issues, where AI could spot something like Alzheimer's years before symptoms even show up. These AI co-pilots could cut down on diagnostic errors by a third. And in the lab, AI could potentially squeeze the timeline for discovering new drugs from over a decade down to just a few months. And look, this isn't some far-off science fiction dream. As this quote from the Boston Consulting Group makes really clear, this is becoming a necessity right now. The best doctors and nurses will expect to have these tools. Any healthcare organization that doesn't adapt isn't just going to fall behind on technology, they're going to fall behind in hiring the very people who provide the care. So here we are, standing on the edge of a genuine revolution. AI is promising a healthcare system that's better, faster, easier to access, and more personal. A system that could solve the exact problems people like Tammy McDonald are facing today. But that leaves us with one of the biggest questions of our time. Are we ready to trust an algorithm with our lives?